panel will focus on AI and health, and together we will look at the opportunities, the risks, and the need for a new kind of governance. And to open the panel, I'd like to invite Dr. Tedros to provide opening remarks, please. Real pleasure and privilege to moderate this panel. The panel will focus on AI and health, and together we will look at the opportunities, the risks, and the need for a new kind of governance. And to open the panel, I'd like to invite Dr. Tedros to provide opening remarks, please.
Thank you, our moderator, Dr. Magdalena Skipper, Honorable Minister Omar Sultan Al-Olama. He's joining us virtual. I hope he will be seen shortly. And Professor Effie Vallena, Assistant Administrator Dr. Atul Gawande, Dr. Marco Marcella, Dr. Karen DiSalvo, Professor Matthias Goyen, Excellencies, dear colleagues and friends. A warm welcome to our panelists, and thank you for joining us today. And a special thank you to the Honorable Omar Sultan Al-Olama, the UAE's Minister of State for Artificial Intelligence, Digital Economy and Remote Work Applications. Some say that AI will unlock a fourth industrial revolution. Others warn that AI presents grave risks. Everybody seems to agree that AI will change the way we live and work, with major consequences for health and health systems. AI holds the promise to improve public health and patient care in many areas, from accelerating research to improving disease surveillance, to predicting strokes and other clinical crises. While AI is a tool with enormous potential, what matters is how we use it. I remember some years ago, I was attending a meeting where Desmond Tutu was speaking, and he was speaking about technology and a knife. Probably a knife was like AI for our ancestors some centuries ago. And he said, you can use a knife for good, and you can use a knife to hurt people. So it's exactly the same, but we didn't stop using the knife because it can be used for bad as well. We can use it for good. And for AI, what matters is how we use it, but everybody understands its benefits. Good governance based on ethical principles, clear policy and regulatory oversight is necessary to ensure safety and equity, while also not hindering innovation. We must also ensure that the use of AI and other new technologies helps to narrow inequities in access to health services rather than widen them. For all these reasons, WHO has made digital health and AI a strategic priority. Our guidance on the ethics, regulation, and governance of AI are among our most accessed publications. And WHO is engaging with AI in a range of areas, including tuberculosis, screening and triage, using chatbots for health promotion, and accelerating our work on normative guidance while preserving quality and integrity. Last year, WHO, the International Communications Union, ITU, and the World Intellectual Property Organization, WIPO, launched the Global Initiative on AI for Health. The initiative will strengthen our collective ability to develop and use AI responsibly, equitably, collaboratively, and based on science. From the discovery of vaccines to penicillin, MRI machines, cochlear implants, and the mapping of the human genome, technology and innovation have always been a driving force in improvements in health. That's why, as part of our transformation, digital technologies and innovation was a major part. And we will continue to develop our department, Digital Innovation and Technologies, to make digital technologies innovation to make progress in this field. WHO is committed to supporting all member states to harness the power of AI and manage its risks as we work together to promote, provide, and protect the health of the world's people. With that, thank you, moderator, and back to you.
Thank you very much, Dr. Tedros, for opening our session and for reminding me and all of us of the WHO's commitment to AI and digital technologies and their importance in health. What we need to remember, of course, is that AI is a well-established domain of research. And it's only after generative AI made its public debut some 18 months ago that it now seems that before long every aspect of our lives may well be affected by AI in some way. But it's useful to focus the mind on the topic of this panel, that AI specifically has tremendous potential to speed us along the road towards equitable health and to improving global health outcomes, both, of course, key goal for WHO. But this can be achieved only if AI tools are just, humane, safe, and ethical, and inclusive. The potential to improve health outcomes includes provided and more efficient diagnosis, treatment recommendations, better intervention delivery, reduced implementation costs, and empowerment and support for health workers. This list is impressive. But in order for the outcomes to be inclusive and equitable, we need sound ethical principles developed in a collaborative and inclusive fashion. We need technical solutions that give us AI tools that are free of any kind of bias. We need transparency to these developments and their applications to ensure their trustworthiness. And frameworks for knowledge sharing are essential so that capacity can be built. And just as an example, in our pages at Nature, we have recently argued that if AI is to help design treatments specific for African populations, then Africans should lead the way on this work. To achieve all of this, we need a truly collaborative approach that would include the public and the private sector, researchers, medical professionals and health workers, policymakers, governments, as well as other stakeholders, including the civil society. They all need to work together. We need a governance framework that is international and inclusive of all of these stakeholders. And let's not forget that cutting-edge developments in this space are often made in the private sector. The governance that we need has to be flexible enough to keep up with the speed of technical developments in AI, and in some cases may need to anticipate them. So we have a really impressive group of panelists here to address many of these issues. I'll introduce them now and call on them in turn to make their interventions. after which there will be a few interventions from the floor, but I hope there will be time for questions from you, so please think of them already as the interventions are made. So we have Professor Effie Viana, who is Professor of Bioethics and Policy at ETH, and she will speak to where we're at with the use of AI for global health. We have Dr. Atul Gawande, Assistant Administrator for Global Health at the US Agency for International Development, who will speak next. We will then focus on the role that governments can play, and for this we are fortunate enough to have with us His Excellency Omar Sultan Al Olama, Minister of State for AI and Digital Economy and Remote Work Applications from United Arab Emirates. And Minister Olama is joining us virtually. Comments on the regulatory perspective will be provided by Mr. Marco Marcella, Director for Digital, EU for Health and Health Systems Modernization. And to provide us with the private sector perspective, we will hear from Dr. Karen DeSalvo, Google's Chief Health Officer, and Professor Dr. Matthias Goyen, Chief Medical Officer at GE Healthcare. And they will share with us their thoughts on private-public.
Thank you. Director General Dr. Tedros, esteemed co-panelists and participants, it is an honor to be here. There's clearly very little doubt that AI presents this tremendous opportunity for global health, and we have sensed this opportunity in the examples we've already heard, but also in the exponential increase of scientific publications reporting on the use of AI in a number of things, including drug development, for example, in the new classes, discovery of new classes of antibiotics, in screening aids with high predictive accuracy in the areas of cardiovascular diseases and tuberculosis, in outbreak surveillance, as well as in digital contact tracing in the recent COVID-19 pandemic. We've also sensed this opportunity in the 882 AI/ML-enabled medical devices that have already been approved by use from the US FDA, and in the increasing number of registered clinical trials, about 3,000 already, that are putting medical AI applications through rigorous testing to assess their safety and efficacy. Generative AI, yet another popular example, has opened a further world of possibilities for global health. With chatbots, processing natural language prompts by healthcare providers or patients have given us hope for bridging capacity gaps in places where we lack sufficient numbers of healthcare providers and giving patients new ways to understand and manage their diseases, especially chronic diseases. The variety in these examples, including the ones we heard earlier, reflect the plurality in opportunities across the spectrum of healthcare and across the world, as well as the fact that AI is not one thing. It is a constellation of technologies which bring about different types of possibilities and challenges. But if this constellation of technologies is as promising as we all believe here, we seem to have a moral obligation to make it work for global health, which means we make it contribute towards improving the health of all people, advance universal health coverage, and enable sustainable and resilient healthcare systems. As AI developments come with blistering speed, we must ensure that they do not perpetuate and exacerbate existing asymmetries and inequities in access to health care. And in order to do that, I think we need to face some of the critical challenges that come with the AI developments. And at least 3 of them, I think, should take priority. First, even if this technology is so impressive, I'd like to reiterate in this room that we still have this obligation to first do no harm. This means establishing and agreeing as a global community on the technical standards that must be met and transparently reported in order to ensure that AI tools can be safely and reliably used in healthcare. Clinical validation of AI tools is our next frontier. But different types of tools will require different assessments. A prediction algorithm in the clinical care setting and a large language model, a chatbot used by patients, will need to be assessed differently. To be assessed, those who develop AI tools, not only those who use them, must be transparent about the data that were used to develop the models, their performance, and its known limitations. Such information can ensure that an evaluation of an AI tool measures its accuracy, reliability, fairness, robustness, and factuality. This will be essential for effective and responsible implementation of human-centric AI applications in diverse environments. Standards and rigorous assessments will also assist us in carefully puncturing the AI hype bubble and putting our resources and expectations to the opportunities that matter in achieving well-defined global health goals. My second point is about that obligation of doing no harm, not stopping there, but rather extending to doing the most good. This can be achieved through setting the right guardrails, it was mentioned already, for what we develop and how we use it. But these guardrails should be rooted in considerations of equity and justice. They must address the life cycle of the applications and should stretch back to data governance, addressing the perennial problem of health data access and quality. We're seeing today a proliferation of global initiatives to govern AI tech as a whole, as well as regulatory action in many jurisdictions and domain-specific areas such as health. WHO has led the way in some of these activities. These are laudable efforts, but will need global effort and collaboration to help countries build the right institutions that can carry forward the implementation of guidance and regulation. Third, it is about enabling human wisdom. Great tools are necessary, but not sufficient for successful global health outcomes. These AI tools are meant to be put in the hands of humans, healthcare practitioners, patients, administrators, payers around the world. Whether humans will accept them, rely on them, and meaningfully integrate them into healthcare systems is what will determine the global health outcomes. Our major challenge is how best to build these AI competencies in all users, not just increasing digital literacy. These competencies go beyond technical understanding and include building capacities for critical appraisal of medical AI and the understanding of the ethical and social implications of AI. These competencies should enable users to be partners, not to give them a false sense of empowerment when they are inevitably confronted with either no choice or with tools that they are not meeting appropriate standards. The challenge we must face is to enable humans across the value chain of health AI to become wiser, to assume responsibility for what they owe to society and to those who could benefit from AI, and ultimately to assume responsibility for reaching our collective goals. Thank you.
Thank you very much, Professor Vallena, for making important statements, including about responsibility, humanity, capacity building, and partnerships in the context of AI in health. I would now like to call on Dr. Gawande, please.
Thank you so much for the chance to speak here. Director General Tedros, Excellencies, Ministers, distinguished guests, and delegates, it's a great pleasure. I want to start by just saying USAID is deploying AI tools with country partners now. And that has given us a deep understanding of the great opportunities and great risks and how we are beginning and just beginning to manage them. First thing to understand is that AI is not going to replace humans in healthcare in the near future. It is right now providing clear potential for augmenting human capabilities for health so that human beings can do more and manage with less complexity and less cost. Many examples of human conditions that have required much higher levels of expertise. As a case in point, Director General Tedros referred to the deployment of chest x-rays, digital chest x-ray systems for TB. In TB, a great difficulty is that it is often latent and unseen without symptoms. So screening with chest x-rays is very important. But capacity of radiologists to have same-day testing of chest x-rays and readout and diagnosis and action makes that very difficult to deploy. So we have 7 countries around the world, including places like Vietnam and Nigeria, where we are now deploying AI-based computer-aided detection software systems that instantly read chest x-rays and give people diagnoses. Using it in high-burden countries, we are seeing that these tools have increased, for example, in Nigeria, case detection of TB cases by more than 1/3 in the course of a single year when coupled with molecular diagnosis. Now, one of the critical things is there are many applications that are potentially coming down the pike. AI-based ultrasound for assessment in pregnancy, AI-based skin lesion detection. Those tools are out there and available. We went with this tool first for chest X-ray in TB. Why? Because WHO did an evaluation and provided an initial set of recommendations that could give us some normative guidance. Because based on that guidance, countries we're working with had confidence that they could begin to have their regulatory systems drive these capabilities forward. And then further, we have a test in case the AI is wrong. We are not relying on this. Coupled with a molecular testing capability for TB that can diagnose at the same time, we can confirm whether someone has TB or not, and then proceed to treatment and not base it solely on an AI reading for a chest X-ray. It gives us either a test or a human assessment that helps us proceed to the next use. There are other uses besides diagnostic interpretation. We know it could help reduce burden on healthcare workers. In Eswatini, we are supporting partners to explore use of generative AI in speech-to-text models to reduce their clinical documentation and monitoring and evaluation forms and reporting that they must do. The types of systems we're actively deploying at the Mass General Brigham, where I used to be employed before I came into the government. And we're seeing these systems move around the world, potentially in equitable ways. There are many, many more applications. The critical components of being able to address these needs are where USAID investments in the digital health space are going. We have long had a set of work around how to enable better digital solution use in countries. The critical architecture of systems for digital health are the same architectures that are required for use of AI tools. They're not fundamentally different. You have to have ways to identify people and connect their data between different kinds of data sets. You have to enable clinicians to access that data and use it, and then you have to ensure security and privacy in the process. Same with the AI tools, and then you have to ensure accuracy along the way. That has required more and more that countries have a digital strategy at a country level, and that strategy is overseen by a digital leader who can make sure that all of the components that have to be executed are being executed. And we're supporting training of country officials, people completing these plans, and enabling this to move out in the world. So my final point I'll just say is I'm seeing how these tools are deploying in the real world. There is great opportunity and there is great risks, but health is the space where we can demonstrate that the good will outpace the bad.
Thank you. Thank you, Dr. Gawande, for reminding us yet again about partnerships across the globe with different countries. I heard about partnership between human and AI itself, and of course that importance of privacy and security and deployment in context. I would now like to call on Minister Olama to make his intervention. Minister, please.
Thank you, Dr. Magdalena. Your Excellencies, distinguished guests, ladies and gentlemen, it's an absolute pleasure addressing the 77th World Health Assembly virtually today in this distinguished panel of global leaders and innovators. And I'd like to say that in most cases, whenever His Excellency Dr. Tedros speaks, I take notes because I'm reminded of the time that he was able to help us forecast what challenges are to come and opportunities in his speech in 2018, where he talked about being ready for future pandemics. I think his remarks on the importance of AI are just a testament to how much we need to focus on this technology and how much work is remaining for us to ensure that the significant breakthroughs of AI and the advancements that we're seeing are there to create the promising returns that are going to make the future better than the current day that we're living in. AI is already accelerating incredible domains in healthcare, such as drug discovery. It's revolutionizing medical imaging as well. It's personalizing treatment plans. It's improving the efficiency of the healthcare sector. And as a country, we are deeply committed to advancing AI in healthcare. Having hosted the Abu Dhabi Global Healthcare Week a few weeks earlier, we chose AI to be front and center of that gathering because we do believe that artificial intelligence is the most important technology in many of the aspects and the domains that we'll be working in as a government. Through my membership in the United Nations Secretary General's high-level advisory body on AI, I'm continually exploring how governments can work hand in hand with the private sector and the different communities to realize the full potential of AI in healthcare. And I'm involved as one of the chairs on the healthcare track more specifically. I'd like to say that the first thing that we're going to see over the course of the coming years is we're going to see centuries worth of change in the coming years. We're going to see artificial intelligence bring with it a lot of promise and as well a lot of peril for the governments that are not prepared to deal with both the opportunities and the risks that this technology will bring forward. There is a need for us to tackle and maybe try to overcome the ignorance issue that exists today within the decision-making processes within governments. We need to ensure that we understand what AI can do and cannot do. We need to understand where the promise is real and where it's a mirage. And we need to understand as well where a use is responsible and will bear fruit for the current generation and future generations, and where applications of AI might actually bear fruit for the short term, but might harm us in the long term. That is why we believe that education is paramount when dealing with deploying artificial intelligence and regulating it across different governments around the world. As a government, we tackled this issue by creating a program with some of the most leading universities around the world, whether it's Oxford University in the UK or the University of Birmingham in the UK as well, to deploy government-specific programs for our government officials to understand what AI is, how AI can be effectively regulated, and to also understand what AI can be deployed for today and what needs to be put in place as an infrastructure requirement to ensure that you can actually bear the promise that AI brings with it. We also need to ensure that the public and public interest is front and center when it comes to AI deployment. To ensure that, we need to ensure that the public is informed, the public is aware, and as well, that the ignorance that might exist because of the Hollywood movies that people have seen or because of the fear-mongering that unfortunately some people have gone through is not dictating whether they fear this technology or whether they want to ensure that this technology is being used in their governments and in their healthcare systems. And the cornerstone of everything that we need to be doing is ethical, responsible, and transparent use of AI. I heard a fellow esteemed panelist talk about the importance of us understanding and promoting transparency within AI algorithms to ensure that these black box scenarios that might harm people over the course of deployment are not catching us by surprise. On the government side, we need to ensure that we have robust data infrastructures that allow us to anonymize data when needed, but at the same time allow us to give access to the algorithms when necessary to ensure that we are able to deploy it effectively and we can scale it up as well. We need to also work together as a collective set of countries and companies as well, and involve the international organizations and bodies to put a standardized set of protocols for data management that ensure data integrity, that facilitate interoperability between health information systems, and that ensure as well that we're able to track, trace, and hopefully understand how AI is being used and how healthcare is being improved. We also need to ensure that our regulatory and legal frameworks are not leveraging on old systems to regulate new technologies. The long-term horizons in putting regulations and in ensuring that we're able to either restrict negative ramifications of the technology or accelerate positive ones need to be changed to fit this technology. We have never seen a technology move this fast in terms of adoption, in terms of use, and in terms of impact as well. We need to create continuous and efficient evaluation and monitoring frameworks to monitor AI systems and to ensure that they perform as expected and that they do not introduce new risks. Every single day that we delay this, there are risks that governments will face, different impacts of AI in different domains. As a country, we believe that this technology is going to be a technology that is going to bear with it a lot of positive impacts. But we need to be leading the charge when it comes to ensuring that the gap of haves and have-nots and the gap between misuse and misuse are not becoming as big as they were in previous revolutions. I'd like to thank you and hope that in future World Health Organization assemblies that I could be with you in person. Thank you very much.
Thank you. Thank you very much, Minister Olama, for reminding us of the importance of education of everyone, of involvement of the general public, of developing standards, and of reminding us of the speed at which these developments are taking place. Thank you again. I would now like to call on Mr. Marco Marcella, please.
Thank you, dear Director General. Dr. Tedros, dear fellow panelists, I'm also very delighted to participate today in this strategic roundtable and present the approach that we are taking at the European Union when it comes to devising regulation, but also other support activities for AI and AI in health care. I mean, only a few years ago, we were talking about AI, we were elaborating on its importance, and now it is becoming a reality as we hear today. And we all see the potential of AI. Now, we touched upon some of the technological developments that are bringing innovations to the table, but there are also aspects where AI can work, for instance, in relation to alleviating the financial burden that we have in healthcare. Essentially, we all agree that this may be a game changer for patients' care, from, as we heard, from diagnosis to treatment plans. Now, we also, I think that there is a wide agreement that in general, it is transformative as technology across the sectors that do refer to healthcare, including pharmaceutical and medical device. Now, it is equally important to make sure that our healthcare force it is prepared to take up this technology, the new technology. And so it is very important also because it will make sure that this new innovation, it is rendered in such a way that is accessible and inclusive, as we were discussing at the very beginning of this roundtable. Now, therefore, it is not just a matter of clinical practice in general, it is a matter of public health. Now, if we look at the examples we already mentioned, I think we also need to make other challenges when it comes to the adoption of that technologies, which relates to the integration of technologies in clinical practices, in healthcare settings in general, and the deployment and uptake of that technology. And there are challenges related to, for instance, integrations of AI and health data management systems, but also in making sure that that technology, it is accepted, it is trusted in clinical practices. So how do we make that to happen? Well, the first step, and that is the approach that I would like to present today, is to make sure that we do have a conducive environment that is shaped through regulations, for instance, that does enable innovation, but it does also enable adoption. And for that reason, I think the first step is creating a clear set of rules that does promote, yes, innovation, but it does so safeguarding patient rights, safeguarding equity, and uptaking high ethical standards. Now, in the EU, we are currently building this environment based on European values and with the people at the heart of this development. Certainly, the first piece of regulation that is already there and is relevant for this discussion, it is the medical device regulation that ensures that clear rules for placing software into the market, securely into the market. But the second part of these enabling regulations that I would like to talk to you about, that is devising at European level, it is the European Health Data Space Regulation. This is a regulation that is currently being, say, finalized. The political agreement has been reached. It will be the cornerstone for developing artificial intelligence applications in the future, because it will create a single data space with clear rules for accessing health data from the patients, who will be able to control their health data, to control access, and to control with whom and for which purposes he wants to share data, his health data, for primary care, but also for secondary use. And the secondary use of health data, it is a major piece of that regulation, because it essentially will create the structure, the technological underpinning, and the rules for reusing safely and trustful health data in the 27 member states of the European Union. So it will essentially create the roaming of health data, but it will also enable researchers that have research projects that they want to focus to access data that is held by data users through a single network access point, presenting a research project and obtaining the data to be analyzed in a secure environment. Now, this is an enabling regulation in that sense, because it will then couple and work in synergy with the AI Act, which is the first set of rules adopted to, say, support the trustworthy, secure, and ethical use and development of AI. And, you know, we do so not only to support the use and the uptake, but also to protect the public interest. Now, the AI Act will set very clear requirements with a risk-based approach, so that developers and also deployers, they will have very clear rules for analyzing, for monitoring, for placing into the market, and for doing post-market surveillance of artificial intelligence solutions. Artificial intelligence, including machine learning and also generative AI. Now, it will address the set of requirements that cover, say, the transparency, but also the ensuring the performance in diverse settings, and also continuous learning, and it will certainly be based on the human oversight. Now, the combinations of the AI Act and the European Health Data Space will unlock the potential of digital and data for health and care across the European Union, and let's say that we're developing these regulations to make sure that the peoples will benefit of it. But as we heard today, I think that these challenges are global, and, you know, and it is in the interest of everyone to work together on developing a conducive environment globally. And I think that it is for these reasons that we very much appreciate the invitations to be in this conference and exchange words and practices on this matter. Thank you again.
Thank you very much. Thank you, Mr. Marcellin, for bringing the European examples and reminding us of the importance of the balance between innovation and adoption. I'd now like to call on Dr. Karen DeSalvo.
Thank you, Dr. Skipper, and good afternoon, Director General Tedros, Excellencies, Honorable Ministers, distinguished delegates, and esteemed panelists. It's really an honor to participate in the Strategic Roundtable on Artificial Intelligence in Health. And as a doctor, I can see that we are at a technological inflection point that heralds the most transformational opportunity of our lifetimes to advance human health, akin to the discovery of penicillin. Generative AI opens to reality the promise that high-quality, affordable health care and optimal health will be available to everyone, everywhere. The capabilities of generative AI lend itself to solving shared global health challenges in areas like workforce shortage, information overload, and the rising burden of non-communicable disease. Imagine a world where geography, socioeconomic status, race, ethnicity, and resource limitations no longer dictate health outcomes. Envision a future where a skilled healthcare provider in a remote village can access the expertise of specialists worldwide in real time. The global approach to AI must be both bold and responsible. Bold in prioritizing use cases that help the most people most significantly. Responsible because, like one of medicine's oldest tenets, we must first do no harm. My patients taught me that health moves at the speed of trust. To build trust in AI, Google's approach is to apply it with privacy, equity, and safety by design. We know that if not applied ethically, AI could amplify existing health disparities. That's why we follow our 7 AI principles that provide a framework to ensure that our AI applications are fair, safe, and effective. Our principles created applications that must, first, be socially beneficial, second, avoid creating unfair bias, third, be built and tested for safety, fourth, be accountable to people, fifth, incorporate privacy design principles, sixth, uphold standards of scientific excellence, and seventh, be available for uses that accord with these principles. AI transformation should happen with communities, not to communities. It will take intentional public-private sector partnership to ensure that AI is developed and deployed boldly and responsibly. Central to Google's approach is actively collaborating with trusted global leaders like the WHO, governments, academia, healthcare providers, and others around the world. This brings the best talent and experience together to work towards the same global health goals. For example, that's why we have a formal collaborative arrangement with the WHO to enable us to work together to amplify public health information and bring digital tools to low-resource environments. We've worked with the Indian government to make open-source AI models available to assess for diabetic retinopathy to reach as many citizens as possible. And we partner with academic researchers with AI technology like AlphaFold to advance scientific discovery, including for new therapeutics. This partnership model exemplifies our belief that health is what we do together as a society to create the conditions in which everyone can be healthy. For our part, we are committed to building responsibly and to adhering to our AI principles in our own work. We also work with the broader ecosystem to establish the performance characteristics needed for the models. We believe that regulation will be necessary, and we're engaging with governments and others in the ecosystem. For example, we're joining up with groups like the US-based Coalition for Health AI to develop guidelines to assess this technology when it's put into practice. And we call on others in the private sector to do the same, and we look forward to working on other global efforts. To meet the moment and ensure equitable and safe application of AI, the WHO should leverage its role as a trusted organization and convener of stature to shape an equitable digital future. WHO should work with partners, including governments, NGOs, and the private sector, to establish normative standards and global governance to see that regulatory authorities can harmonize expectations for performance, safety, and bias in a transnational fashion and support regulatory review and implementation in a way that leaves no one behind. I will end by emphasizing that humans are at the heart of health. AI will not replace healthcare providers, but healthcare providers who use AI will replace those who don't. At Google, we're committed to working in public-private partnerships to unlock AI for health in a bold and responsible way. Thank you again, and I look forward to the questions.
Thank you very much, Dr. DeSalvo, for reminding us again about the importance of trust, accountability, for bringing scientific excellence into the conversation, and yet again for referring to partnerships and the importance of co-creation. And now I'd like to call on Professor Goyen, please.
Thank you, Magdalena, dear Director General, Dr. Tedros, dear ladies and gentlemen. It is my firm belief that public-private partnership can play a crucial role in the development and implementation of AI solutions to strengthen health systems. There are a couple of emerging trends that I see for AI in healthcare. First of all, precision care. doing the right thing at the right time for each and every patient. We need to focus on AI-driven personalized treatment plans based not only on the traditional radiology data, meaning data coming from the machines, the CT, the MR, the ultrasound, but also based on genetic, environmental, and lifestyle factors. 97% of all medical data that is generated is not used, goes directly to the archive. Let me repeat that. 97% of all healthcare data is not leveraged directly, goes to the archive. And we have to change that. And I'm pretty sure that public-private partnerships will be pivotal in integrating all these different kinds of data sets and developing a tailored interventional approach. Another point that is very important looking into the future is telehealth services. There is the need for enhanced AI tools for remote diagnostics and monitoring. They will require a collaboration between public health bodies and tech companies to ensure accessibility and integration with existing health systems. For example, in ultrasound, via guidance software, we enable non-expert healthcare workers to receive support by the AI that is integrated into the device so people know where to place the ultrasound probe on the patient to obtain good image quality. And this is very relevant for maternal and infant care, for abdominal exams, breast cancer, etc. And one of the key challenges is training of healthcare workers, if you see it on a global scale. And mobile handheld ultrasound, like this device here, could be in every community worker's pocket so that this person can do a focused ultrasound directly at point of care and could do checks, easy ultrasound checks. These small devices have built-in AI capabilities that enable the not so experienced user to make his or her diagnosis. And when you think of access to care, of course, these tools could dramatically, help to advance also some of the UN Sustainable Development Goals, such as improving maternal and infant care. We all know that healthcare is a business of trust. In healthcare, it is essential that AI systems are developed with ethical considerations at their core, prioritizing patient well-being and ensuring a robust data privacy and security measures. There will be a growing emphasis in the future, that is what I predict, on these ethical AI uses and secure data handling. And public and private sectors will need to collaborate on this topic to establish and enforce standards and regulations. I predict there will be more AI solutions tailored for global health challenges, with PPPs being crucial addressing issues in low and middle income countries by combining public health expertise with private innovation. I think this could be a beautiful marriage. We at GE Healthcare are heavily investing in R&D for AI technologies, focusing on creating advanced diagnostic and therapeutic tools. We are leveraging partnerships globally with academic institutions, biotech companies, and healthcare systems to stay at the cutting edge. There is one point that is very close to my heart, being a radiologist, and this is the clinical integration. We need to develop AI tools that are easily integrated into the respective clinical workflows. The best AI is the one that is invisible, that is seamlessly integrated into the respective workflows. I think we at GE Healthcare have done everything right if the radiologist or clinician doesn't even know that AI is at work. AI is just doing the magic in the background. You could say AI is the physician's invisible friend helping them run faster. We at GE Healthcare aim to lead the transformation of healthcare through innovative AI solutions and strategic public-private partnerships, thereby helping to create a world where healthcare has no limits. Thank you.
Thank you very much, Professor Goyen. Once again, partnerships, very gratifyingly, ring very loudly true. And thank you for focusing our attention on the opportunity for AI to help us fully harness health-related data to make better decisions in many different contexts, including in the context of remote diagnostics. And again, you alluded to what we started, what we mentioned at the start of the panel, and that's empowering of non-experts with AI-based tools. So I'd like to thank the panelists, and before we move to the question part, I'd like to invite a couple of interventions from the floor. There is an intervention from Palau representation. May I call for that intervention first, please? Please.
Thank you, Dr. Skipper. Good afternoon, Director General Dr. Tedros, Excellencies, Honorable Ministers, distinguished delegates, and ladies and gentlemen. And thank you as well to the esteemed panel for such an invigorating and interesting panel discussion this afternoon. It's certainly a great pleasure for me to be here to be discussing with all of you the very exciting topic of AI, which, as we have heard, we can all expect will usher in a new era of health technology and bring about significant advancement for health globally, and especially in the small island developing states such as Palau. So as a small island member state, we do face unique challenges in our healthcare systems: geographic isolation, limited resources, and our vulnerability to climate change are just a few of the obstacles that challenge us with the successful delivery of quality healthcare, especially to remote and isolated islands and communities. These challenges thus drive us to seek more innovative, effective, and efficient ways to improve access and quality of public health and healthcare services to our populations. Today, we stand on the brink of a technological revolution, as we have heard, that can truly transform our healthcare landscape, which is artificial intelligence. AI, with its capacity to analyze and vast amounts of data, recognize patterns, and make predictions, offers unprecedented opportunities not only to enhance healthcare delivery, but also affords us the ability to make better decisions based on credible and relevant data. Let me outline a few ways in which AI can be harnessed to improve health conditions and outcomes in SIDS by illustrating some of the activities we're implementing in Palau. Through our digital health and data modernization initiatives, we will be incorporating the use of AI in our EHR systems, including predictive analysis capabilities to project disease burden trends and identify health disparities among our primary care patients. Another example is we plan to use AI to identify chronic disease patients who are most likely to miss appointments and follow-ups based on records and identified correlating socioeconomic factors. We're also looking into enhancing our telehealth and telemedicine initiatives with AI to provide better direct patient care to our remote islands where specialized medical professionals are unavailable and transportation is a barrier to healthcare access. This would allow us to reduce the need to refer many of our patients abroad to receive advanced medical care. Such AI-driven telemedicine platform can bridge this gap by providing remote consultations and diagnostics, offering personalized advice and support to people, ensuring they receive the right care at the right time, regardless of their location. AI can also support in analyzing large data sets from different sources and help us with enhanced disease surveillance and prevention, including vector surveillance for zoonotic events and threats. Furthermore, it can assist us in optimizing our healthcare resources. In resource-limited settings such as Palau, it is crucial to make the most efficient use of available resources. Given that the Pacific Islands are challenged with an ever-growing burden of NCDs, and AI can play a pivotal role in personalized medicine, as has been mentioned. By analyzing individual health data, including lifestyle factors and environmental influences, AI can help tailor health interventions to the unique needs of individuals. However, again, as has been mentioned, as we look to embrace AI, we must also address the challenges that come with it. So it is essential that we work collaboratively with WHO, international partners, technology providers, and our own communities to ensure that we have adequate and appropriate guidelines and regulatory frameworks in place to govern the use of AI to ensure its ethical deployment in health technology. In conclusion, artificial intelligence does present a transformative opportunity for small island developing states to overcome our unique challenges in healthcare. By leveraging AI, we can significantly enhance health outcomes for our populations, especially for those who are most vulnerable and unreachable. Together, we can create a future where quality healthcare is accessible to all, no matter how small or remote our islands may be. Thank you.
Thank you. Thank you very much, Minister. And now I'd like to invite a short intervention from Australia, please.
Thank you, Chair. Can I also thank the DG moderator and panellists for sharing their expertise today. It is great to see such a focus in the Assembly at this time on this topic. As we've heard today, it's really hard not to be excited by the opportunity that AI presents. However, as we've also heard today, as AI increasingly becomes a feature in people's health and in health systems, it's equally as hard to ignore the risks that if not appropriately managed, AI could actually deepen divides in health outcomes. Australia agrees with the comments that Member States must consider how AI impacts our societies, including those who may be in vulnerable situations or indeed part of marginalised communities. This requires approaches that protect human rights and privacy and manage bias and fairness in AI technologies and associated data. This will help ensure AI is being used safely and responsibly. Australia believes we should consider how governments can promote the development of safe and responsible AI that is firstly sustainable from a business perspective, but that its application, secondly, is also equitable, inclusive, and thirdly, strengthens our health systems and patient outcomes. In this context, and given the pace of change, Australia sees great value in an update to the WHO Global Strategy on Digital Health that expires in 2025. More broadly, we're keen to hear attendees and panels' reflections about the role that the WHO can play to maximise opportunity and minimise the risks on these issues of equity. Also interested on views of how best to ensure consistency of global approaches. Thanks, Chair.
Thank you very much. Thank you for reminding us that we have to be mindful of the risks and we have the responsibilities, and the solutions need to be developed in partnerships in a global context. So I'd like to move to the question part of this session. At this point, I'm not inviting further comments, but I would like to ask if any of you in the audience have questions for the panelists in response to the statements that you've heard. I can take a couple of questions from the floor. There is a question over there, please.
Sorry, my name is Matilda Forsland. I'm the Executive Director of Transform Health. I think some of the panelists here have highlighted the importance of the need for better data governance regulation. So I would like to ask the panel here what you would recommend to WHO and its member states in terms of better data governance regulation and potentially a WHO resolution to get us to the next stage. Thank you.
Thank you very much. And can I have another question before I turn to the panel? Another question from the floor? That was a good question. Oh, there's a question over there, please.
Nyssen, I'm a professor in medical informatics and representing the IFMBE biomedical engineers. I have a question for the panel about scientific excellence. We were taught that for scientific approval, you need known mechanisms, known data, reproducibility, and error margins. You must know the error margins of the device or of the software. The question is, are there new criteria to evaluate AI or are these ones still valid? Thank you.
Thank you very much. Two excellent questions. Please hold your question. I'm hoping to come back to you. I am going to direct the first question about data governance first to Professor Vallena, and then see if anyone else has any comments.
Well, thank you for the question. It is a critical point, and I just wanted to also draw the attention to some of the work that WHO has already done in the regulation, in the ethics and governance, with the ethics and governance group for artificial intelligence, where we dedicated a whole section on the needs for data governance. Now, again, this is a first step, an important step, but I do think more needs to be done. That is at the level of guidance. Then there is at the level of implementation in the countries. And I think this is where we need to put our effort. There are some countries where inevitably over the years have worked more on that, but there are so many countries, some might be surprise countries, that I think need to work very much on the data governance. So we do have the principles, but what we would need is support for the countries to go ahead with implementation of these governance approaches.
Thank you very much. Anyone else from the panel would like to add anything on data governance? Please.
Well, just to share, say, the experience that we're having in developing a framework, say, with a regulatory framework on, say, the European data space, I guess that the important part of that equation is to have that rules also in relation to the General Data Protection Regulations, that we do have a framework that generates trust in the citizens that will actually use and share the data in a confident way. So that is fundamental. So together with the safety and with the rights, say, to high-level protections of health, I think that basing the developments on fundamental rights, which includes privacy and data protection, is key for ensuring that trust.
Thank you very much. Very important point. And the second question was about scientific excellence. Do we need to reimagine the criteria? Dr. De Salvo, you knew I was going to come to you because you mentioned scientific excellence.
Thank you. And thank you for the question. It is one of the reasons that it's going to take, frankly, collaboration to begin to understand how to understand the performance of the models from a quality standpoint, and also what are the ways that we will assess and measure and track on areas like safety, but also bias. In the traditional models of AI that were straight shot, so they were built to do built for a purpose, and we had ways that we could measure all the things that you're describing. What is the area under the curve? How well will it perform at that task? This new generation of models can be pointed at new tasks that it's never seen before and attempt to undertake them. They also have multimodal capabilities. They can read images, they can listen to audio, they can use computer vision to see. So I think as the global ecosystem begins to consider the guardrails and the regulatory framework to evaluate not only the effectiveness but the safety of the models, we are going to have to think of broader approaches. And it may very well be that, for example, we need to think about how we do assessments of health professionals, since they also have multimodal capabilities as they advance through the health ecosystem. But it is, in my estimation, one of the most important urgent things we all need to collectively work on, including with academia, because we will need research to underpin whether those decisions and measures are appropriate.
Thank you very much. And if I may use prerogative of a chair as editor-in-chief of a scientific journal, scientific excellence, of course, is something I spend a great deal of my time thinking about. And one thing that strikes me, something that we don't consider sufficiently, is in many ways the criteria, as you described them, refer to experimental sciences. If you think about social sciences, those criteria have been rather different. So I think perhaps it's time to become more inclusive and collaborative in exchanging these definitions across disciplines as well, to help us develop criteria for scientific excellence in newly emerging disciplines such as AI and its capabilities. But excellent question. We do have time for the question. There was a question over there. Please go ahead.
WHO. I think the AI may be a tools that follow the same rules that garbage in, garbage out. So my comment is mainly related to how then we define the type of data that need to be collected so that at the end we have a better output that can support also decision making. There is the minister who just mentioned the issue of modeling, of also surveillance of disease, but all these may require a lot of work ahead to make sure that at least you clearly define the type of data that you need to collect, as well as also the process of analytics so that you can make a better use of it. So it's just a comment, and the panel can probably input it. Over.
Thank you very much. Anyone would like to make a comment? How do we define the data?
I can begin, and I very much appreciate you raising the question, because even in currently active AI models, it's a challenge. Many of the images, for example, that are publicly available for use for training the models are collected or captured in high-income countries in clinical environments from people of light skin or and don't represent the diversity of people around the world. An example of how we work with academia to build out data sets to better improve and inform AI models is some work we've done in dermatology, an effort called Skin Dataset, and we're working with academic organizations in the United States, Stanford and Harvard, to build out better data in so it's more reflective of the global population and therefore can be more applicable and useful to populations around the world. It's going to take, again, collective effort for all of us to work together to see that we are more representative not only of data in, but of the scientists and developers who are creating models so that they can be most useful to people in the environment.
Thank you very much. We do have a couple more interventions from the floor. Can we please have an intervention from ITU? Please go ahead.
Thank you, moderator. Director General Dr. Tedros, Excellencies, distinguished panelists. On behalf of the International Telecommunication Union, UN leader in digital technologies, I thank you for the opportunity to contribute to this timely roundtable. As some of you may know, this morning, just across the street, ITU, together with more than 40 UN partners, including WHO, opened this year's edition of the AI for Good Global Summit, an action-oriented platform promoting AI to advance climate, health, and other global development priorities. At the same event, 6 years ago, WHO and ITU jointly launched the AI for Health Focus Group, a concrete example for a partnership. This group published many reports and technical specifications, as well as some implementable code, covering ethical and regulatory guidelines, use cases, technical specifications on data acquisition and handling, as well as methodologies to benchmark machine learning models in the field of health. The momentum of this focus group is carried forward in the Global Initiative on AI for Health, launched in July last year and led by WHO, ITU, and WIPO, each bringing unique expertise and contributions to this initiative. At ITU, we believe that interdisciplinary collaboration among UN agencies with governments, private sector, civil society, and academia is a key enabler to governing AI for good. I would like to close by acknowledging again the strong collaboration between WHO and ITU on topics related to artificial intelligence and digital health. Thank you.
Thank you very much. Thank you. This is clearly a very important topic, many questions, many potential comments and interventions. time is not our friend. We're coming to the end of the session. But to close the session and summarize it for us, I'd like to invite Regional Director Dr. Saia Mau Piukala to close the session for us. Please, the floor is yours.
Director General Dr. Tedros, Moderator Dr. Skipper, esteemed panelists, excellencies, distinguished delegates. As we bring this enriching roundtable discussion on artificial intelligence for health to a close, I want to extend my deepest gratitude to all of you for your active participation, insightful contribution, and commitment to advancing AI in global health. As we heard today, artificial intelligence holds immense potential to transform health, particularly in resource-limited settings, where it can have enormous impact. AI can revolutionize how we approach protecting, providing, and promoting health through innovative solutions to long-standing challenges. Alongside these opportunities comes significant challenges that must be addressed for the safe and responsible use and equitable access to AI. With the rapidly evolving digital health landscape in advanced areas, such as AI in many settings, capacity gaps keep widening among the health workforce and people. This gap needs to be bridged in order to leverage AI to its fullest potential. Remote and underserved populations are at risk for further disparities due to limited investment in such technologies, and this is exactly where AI could have greater impact. We must work to bridge the digital divide and ensure that no one is left behind in the AI revolution. Transparency and accountability in AI systems should be ensured. We need to develop standards and protocols to ensure that AI algorithms are transparent, unbiased, and subject to rigorous testing and validation. We need robust assessment mechanisms to ensure its safe and ethical use. The misuse of new and emerging technologies, such as AI, may accelerate the spread of misinformation and disinformation. In achieving these challenges while maximizing opportunities of AI for health, international cooperation and multi-stakeholder engagement are essential. Partnerships are key. Governments, private sector, academia, and civil society must work together to create a cohesive governance framework that supports innovation while safeguarding public health interest. WHO can play a pivotal role in coordinating these efforts, providing guidance and fostering partnership to ensure that AI serves as a force for good in global health. The Global Initiative on AI for Health, launched jointly by WHO, ITU, and WIPO, is a good example of such collaborative efforts. The GBW14 has been developed with the potential opportunities and risk of AI in mind. In the Western Pacific region, we are also incorporating this into our draft regional vision, weaving health for families, communities, and societies in the Western Pacific region, working together to improve health and well-being and save lives. We are also developing a new regional action framework on digital health, which will be considered at the regional committee later this year. The draft regional action plan will assist countries' journey of harnessing digital transformation towards people-centric health. WHO will be leveraging digital transformation and information system for better health. Ladies and gentlemen, The potential of AI in health is boundless, especially for those in resource-limited settings. However, there is a lot that needs to be done to ensure it's safe and responsible. By addressing these challenges and fostering inclusive, transparent, and ethical practices, we can unlock this potential and create a healthier future for all. I would like to thank our moderator, Dr. Skipper, our panelists for their invaluable insight and contribution. Your expertise and perspective has enriched our understanding and will undoubtedly guide our future efforts. Thank you once again for your engagement. Let us continue to work together to harness the power of AI for the betterment of global health, ensuring that no one is left behind. Thank you.
Thank you very much. Thank you very much for this.
Thank you.